And thanks for being with us here on Morning Live. Now, the much-awaited 1 million doses of the Oxford University-AstraZeneca vaccine from India's Serum Institute will land in South Africa today, with another 500,000 doses due later this month. Now, this is what is being reported. And initially in the Sunday Times, they reported that Health Minister Dr. Zweli Mkhize has said that a further 20 million are due from Pfizer, plus the 9 million doses from Johnson & Johnson and an additional 12 million from COVAX. So to discuss all of this and, of course, our first vaccines and give us a little more insight into the rest as well, we're joined by the Department of Health's Deputy Director General, Dr. Anban Pillay. Dr. Pillay, thanks for your time. Welcome to Morning Live.
Good morning to you and good morning to the viewers.
Now, Dr. Pillay, firstly, the Oxford University-AstraZeneca vaccine making its much-awaited arrival in the country today. So let's begin with that vaccine that we know about, that is arriving today. So can you please explain to us the process that has to be followed that will take, as we are told, up to 14 days before the first injection is actually taken?
Yeah, I think the 14 days is probably a maximum, but the process is once it arrives in South Africa, it will be taken into cold storage, since it's a vaccine that must be kept within cold storage. Thereafter, the samples of the vaccine have to be taken to the National Control Laboratory, where they will be tested, and there will be various tests done on them to confirm the quality of the product, that the cold chain has been maintained, etc. And once they are happy that the product has not been affected by the transit process from India to here, they will then give us the go-ahead to release the product. We have agreed with the provinces as well as with the private health sector on the quantities of vaccines that we will dispatch to each of the sectors. And so the BioVac will then start distributing that to each province. The provinces will then take that into stock and start the vaccination process at a number of sites across each province. Each province has their own plan about where they're going to start and how they're going to move from facility to facility to make sure that the healthcare workers are vaccinated.
So are you, as the department, satisfied that all the provinces have done the work, and sufficiently so, given that we have DENOSA in KZN saying that they are concerned that they were not part, their members, they speak on behalf of their members, saying that they were not part of this rollout plan?
Well, I'm not sure, because the provincial health department officials were part of the training. We continue to do training with the nurses in each of the provinces, and the training is also available virtually, so those who cannot attend the particular training session can actually just download the training and have it done. But we will follow up with the DENOSA to understand exactly what seems to be the problem in terms of getting information about the vaccination program.
Which then begs the question, Dr. Pillay, we were reporting in the news earlier that the Eastern Cape, they are training about 500 inoculators. Do you know, as a department at this stage, how many people have been trained in total to actually inoculate people across the country?
Look, my colleague actually manages the training itself. I don't have a number, but I think it's also fair to say, as I said, this is virtual, so people download it on their own as well. So I'm not sure if there would be an accurate number of exactly how many people have been trained, given that it's virtual training and they don't actually attend a classroom session as such.
But is that not a point of concern for you, Dr. Pillay? Because how are you sure? How do you know that people actually, if they may have downloaded, it doesn't mean that they have actually gone through whatever material you've put up there?
Well, I mean, vaccination is a scope of practice of many health professionals, doctors, nurses, and pharmacists as the key groupings. They trained in doing vaccination. The particular vaccine, in this case, the information that's new for them is largely how you store it and how you dilute it. I would anticipate that they are very familiar with how vaccination should be done. The package insert and other information is available with the shipment, so they should be able to also gather some of that information there. So the training is just meant to supplement what they already know. And it's not as if they don't know how to vaccinate, and this is the first time they're going to be doing vaccination.
But let's talk about the storage process, for example. You talk about the Pfizer vaccine as one where we're told it needs to be stored in more than minus 70 degrees Celsius. And are there any tender processes still underway, or have you already concluded all of that with regard to the storage and distribution of the vaccine?
We are busy finalizing the terms of the tender, and we'll advertise that, I think, this week, so that for the next shipments that are coming through, we would be able to find a provider that would be able to manage some of that. Specifically talking about the Pfizer vaccine, we do know that the commercial storage of this vaccine at minus 70 is very limited capacity. However, we have learned through the process that there are a number of these minus 70 fridges at our research institutions at universities. They're not necessarily commercial, but they're being used at universities. So we've been talking to a number of the universities, and they are quite willing to loan us these minus 70 degree freezers, which we can then use temporarily to store the Pfizer vaccine. So I think there is an opportunity for us to expand our storage capacity of this minus 70 degree vaccine.
So, Dr. Pillay, let's just talk about what we are expecting as a country in terms of those jabs. So we know that 1 million doses are arriving today. Then there's another 500,000 expected during the course of this month. But now we're also hearing about others from the COVAX facility, Johnson & Johnson, and of course Pfizer. So all in all, how many doses of the vaccine are we expecting, and by when?
Well, we need to vaccinate 40 million people, and so we're trying to secure doses for 40 million South Africans. So the numbers you've quoted are the agreements that we have in place currently. The COVAX facility is probably going to be the next deliveries that come through. They have communicated to us on the weekend, indicating that probably by the end of February or in March, we can expect deliveries from them of vaccines as well. And they've put a figure of about 2 million doses coming through at that time. So we're anticipating that those supplies will come through around March. And then the Pfizer vaccine is mainly going to be available in Q2, which means from April going forward. And the Johnson & Johnson vaccine as well is currently scheduled to arrive sometime in Q2, given that most of those vaccines are still very much in production, and global demand is quite high relative to supply.
So with the doses that are set aside for healthcare workers, what are the exact numbers that we're talking about in terms of healthcare workers in the country? Is it less than 1.5 million? And if so, where does the rest of that go?
So the healthcare workers must get 2 doses. So this is the first dose that they're receiving. We estimate there were about 1.2 million healthcare workers. The number is an estimate because in the private health sector, many of them are in independent practice. So you don't actually know the exact number, and they've been asked to register. And many of them have, but the others are encouraged, obviously, to register through the B4SA structure, so that we know exactly who they all are and we'll be able to reach them. So we're estimating it's about 1.2 million healthcare workers.
And what about those healthcare workers who choose not to be vaccinated? What happens to them? Do they have a right to decline?
Yes, they have a right to decline. Any South African has a right to decline being vaccinated. We would obviously encourage everybody to be vaccinated, and we'd want to understand why they're not vaccinating. And if they share the reason, maybe we can engage them on that and have a discussion about why it would be more beneficial to vaccinate than not vaccinate.
And then, of course, talk about the local variant of the coronavirus, and specifically now with the Oxford University-AstraZeneca vaccine arriving and this new variant. There's such mixed messaging depending on who one is listening, Dr. Pillay, who you're listening to. Some saying it's good news, others stating it's an unknown. How confident are our medical and scientific advisors that this particular vaccine will actually be effective?
I think it will be very difficult to predict that outcome. What is happening is that the laboratories are doing some tests on whether this vaccine will be effective against the variant, but it's only one dimension of the assessment, and hopefully we would get results sometime this week. I do think it's important to also appreciate that vaccines stimulate a number of immune responses. And the only way to really understand what effect it's going to have is when people actually take it, because trying to predict this in a laboratory may not be the appropriate measure. So we will continue to move on along the pathway of vaccinating people, and if the variant proves to be a hindrance, then we will deal with that in terms of amendments to the vaccine. So the vaccines are able to be adjusted in terms of their development and structure so that they respond to the variant.
And then, of course, questions being asked about a vaccination registration program. Is there a national registration process in place yet? And how will this be achieved? Who will provide? Are you going to receive a card, or is it just going to be a system that's in place electronically? How is that going to work?
Yeah, so the electronic vaccine system includes a registration. In this first phase, most of the healthcare workers have already been uploaded onto the system, since their employers have shared their details with us in anticipation that they will be coming through to be vaccinated. The registration process is just to confirm that you are going to get your vaccination at a particular site itself. And once you do that, you then go through to the vaccine site, and they would then be expecting you, given that you're now on their system, to be vaccinated at that point. And once they vaccinate you, there will be an electronic certificate as such that can be issued to you, which is printable as well, that confirms that you've been vaccinated and this is the vaccine you received, the date, and those kinds of details will be available.
And what about politicians, the president, for example? When will he be receiving the vaccine?
I think we just need to finalize when that exact date is going to be, but we certainly would want our leaders to vaccinate publicly so that everybody has confidence that this vaccine is effective and safe as well, and we would encourage everyone to do that. I think when our leaders vaccinate publicly, that sends a very strong message.
So when we talk about our leaders, exactly who are we talking about? Are we just talking about the president and cabinet members, or are we talking about parliamentarians, the judiciary? Exactly how is this going to play out? Because who is next after healthcare workers? To be specific, because these are questions that you find people are asking on Twitter, some of them frontline workers who don't seem to know, Dr. Pillay.
Yes, so after healthcare workers, we go to phase 2, because healthcare workers are phase 1. In phase 2, one of the groupings is essential workers, and within essential workers are parliamentarians, the various political levels, whether they're provincial, local, national, including ministers, etc. So the Ministerial Advisory Committee have placed them in that category. So certainly we would be pursuing that. I was talking more about in this phase, before healthcare workers receive the vaccine, many may want to get the assurance that the leadership has brought a vaccine that is effective and safe. And so there's been a recommendation that they take the vaccine publicly, so that that demonstration is very clear.
And with that, again, will there be any further clarity in terms of who is who in terms of those categories? Because we take it for granted, but if you scour the social media platforms, you will find that people actually don't know.
Well, in phase one, it's very clear who healthcare workers are, and we've been engaging with the employers so that we extract that information. In phase two, we do get requests for additional groupings to be added to phase two. I don't think it's a closed list as such, because essential workers are largely those that are in the front line, that are responsible for service delivery that is critical for the running of the economy and the country, and essential services such as teachers, policemen, the military, etc. So there's a number of those groupings, and some may not necessarily be listed. And over this time, as we're going through phase one, additional groups may want to be listed. Also to say that in phase two is groups that are over 60, so the South Africans that are over 60 years, those with comorbidities, and people that are living in congregate settings, such as care homes, hostels, and those types of environments that we'd want to vaccinate. So sometimes you may not fit into one category, but you may fit into one of the others. So it's a case of making sure that everybody is covered in the vulnerable group within phase two. In phase three, basically everybody over 18 years will be eligible to be vaccinated.
So the timelines, Dr. Pillay, by when do we hope to have, inoculated enough people to achieve herd immunity?
Well, our estimate is that we should try and do this in a year. This will be highly dependent on the supply of vaccine in terms of what quantities we get in what timelines, because that would limit the rate at which we can vaccinate people. But we would try to do this in the shortest period of time possible.
And then two quick questions on clarity. The first one, people have been asking, is this something that you only need to take once? So when you receive the vaccine, it's just a once-off, whether it's the 2 doses that you need to take for the Oxford-AstraZeneca or others, and how they are administered? Is it just once that you take it and you're good for life? And maybe let's start with that question, Dr. Pillay.
It's a good question. I don't think we have the answer yet. Certainly at this stage, we're talking about just the 2 doses. But if this vaccine, if this virus, is recurrent and keeps emerging with a different variant, then you may end up in a situation like we have the flu vaccine, where every year you're going to have to take a booster dose as such to cover particular variants and strains of the virus. But at this stage, we're just talking about the 2 dose. Let us see how this virus behaves going forward.
And then for that reason, I'm glad I held off on the second question, because then people start worrying about the cost. Because even right now, people are not clear as to whether this is going to be free, whether they're going to have to pay at some stage. Please speak to us about the cost of this particular rollout plan.
So I think for everybody that's going to be accessing the vaccines, it will be free at the point of care, meaning you don't need to pay anybody any money in order to receive the vaccine. On the medical scheme side of things, it's a prescribed minimum benefit, which means that the medical aid will be paying for your vaccine. In the public sector side, as you know, vaccination services are free, and so that service will continue as a free service. So you shouldn't be paying for the vaccine at all.
Well, we have to leave it there. Thank you so much for your time this morning. And that, of course, it was Dr. Anban Pillay talking to us about the COVID-19 vaccine that's arriving from the Serum Institute of India this morning, or today, should I say, whatever time it will arrive. It is expected in South Africa sometime today. And President Cyril Ramaphosa will be one of those in attendance at the arrival of that first batch of vaccines. And much more coming through, and I see your questions, I see your reaction as well, but let's just put that question of the day up for you.